Hello everyone, welcome back to another video. This is the second video of our series on breast cancer. In the first one, we discussed the risk factors, warning signs, and various tests used to diagnose breast cancer. If you have not watched that video, I have added the link in the description below. I said that there are three types of breast cancer: hormone positive, HER2 positive, and triple negative. In this video, we'll talk about the most common type, hormone positive breast cancer, which represents 70% of all breast cancers. I will explain what hormone positive means and how we treat each stage. Let's get started. Breast cancer cells have receptors on their surface. Think of these as locks. Your body produces hormones. Estrogen and progesterone are the two important hormones in women. Think of these as keys for the locks. Hormones are required in women, but sometimes they also help the cancer cells grow. In simple terms, hormones act like food for the cancer. If the biopsy shows estrogen or progesterone receptors on the cancer surface, we call it hormone positive breast cancer. This is actually a favorable news because hormone positive breast cancer grows more slowly than the other two types. They respond well to medicines blocking the hormones. Let us now discuss what are the different stages of breast cancer and treatment options. Stage 1 and 2 are called early stage. Stage 1 means the cancer is small, less than 2 centimeters. Stage 2 includes cancers that are 2 to 5 centimeters, or if it has spread to lymph nodes, up to 3 of them. For stage 1 and 2, surgery is usually done first. There are two main types of surgery: breast conserving surgery and mastectomy. BCS, as the name suggests, means that only the cancer is removed and most of the breast is preserved. In mastectomy, the entire breast is removed. Breast reconstruction is an option after mastectomy, using muscle or silicone implants. After surgery, we will consider you for three main treatments to reduce the chance of cancer recurrence. First is radiation therapy. If you undergo BCS, you will always need radiation therapy. If you undergo mastectomy, radiation is needed only if the tumor is large, lymph nodes are involved, or other high-risk features are present. Next, we see if you need chemotherapy. Chemotherapy is not always required for patients with early-stage hormone-positive breast cancer. We make this decision based on certain factors. Hormone therapy comes next. These are tablets. They block the hormone receptors and prevent hormones from helping the cancer return. There are two main options. If you're still having your cycles, the medicine is tamoxifen. And if you have attained menopause, the medicines are called aromatase inhibitors. There are two main types, letrozole and anastrozole. You take one pill a day for 5 to 10 years. Some patients may have side effects like mood swings, hot flashes, etc. Most of these side effects go away in a few months as your body adapts. Aromatase inhibitors may weaken your bones, so you may also have to take calcium and vitamin D supplements and sometimes injections to strengthen your bones. One question patients usually ask is this: my cancer was removed after surgery. Why do I still need chemo and hormone therapy? The answer is surgery only removes the cancer that we can see, but there can be cancer cells floating in the blood which can make the cancer return. Chemo and hormone therapy take care of these residual cancer cells. Stage 3 is called locally advanced, meaning the cancer is larger, more lymph nodes are involved, but there is no spread to other organs yet. In these situations, surgery at the beginning is difficult because the cancer is big. We start with chemotherapy to shrink the tumor. Usually, chemotherapy is given for 4 to 6 months. The advantage of shrinking the tumor is that even breast conserving surgery can be performed. After surgery, radiation therapy is almost always needed, then hormone therapy for 5 to 10 years. For some patients with a higher risk of recurrence, we may recommend medicines called CDK inhibitors. Stage 4 is called metastatic disease. The cancer has spread to other organs like bones, liver, lungs, or brain. Our approach is different here. We cannot cure metastatic cancer. Our goal is to control the cancer and help you live as comfortably as possible. The good news is that stage 4 hormone positive breast cancer can be controlled for many years. We use treatments in sequence. When one stops working, we move to the next. We have many options. In the first line, we use a combination of two medicines, hormone therapy plus a CDK inhibitor. For the hormone part, we usually use an aromatase inhibitor if you attain menopause, like letrozole or anastrozole. If you're still menstruating, we may suppress your ovaries with medicine or surgery to stop the hormone production. CDK4/6 inhibitors are newer drugs, palbociclib, ribociclib, and abemaciclib. These drugs help hormone therapy work better by stopping cancer cells from dividing. When cancer progresses, we switch to a different hormone therapy. An injection called fulvestrant is often used, given once a month. If cancer progresses further, newer medicines like alpelisib or elacestrant are options for patients with specific mutations. We avoid chemotherapy as long as possible because hormone therapy has fewer side effects. Eventually, the hormone therapy may stop working and we'll have to switch to chemotherapy. Chemo is also preferred in some patients where the cancer may be growing rapidly. Chemo works faster in such patients. There are 4 to 5 different types of chemo which are effective at this stage. Usually one drug is given at a time to reduce side effects. We continue as long as it is working and you can tolerate it. When one stops working, we try another. Radiation therapy may be used to control symptoms. For example, if the cancer has spread to your bones and you are in a lot of pain, or if it has spread to your brain, etc. In summary, hormone-positive breast cancer has estrogen or progesterone receptors on cancer cells, and hormones help cancer growth. It's the most common type, usually grows slower, and respond well to hormone-blocking medicines. For early-stage cancers, surgery comes first, either breast-conserving or mastectomy. Radiation is always needed after BCS and sometimes after mastectomy. Chemotherapy is personalized and long-term hormone therapy is used to prevent recurrence. In locally advanced cases, tumors may be large or involve many lymph nodes. Chemotherapy is often given first to shrink the tumor, followed by surgery, radiation, and hormone therapy. High-risk patients may also get CDK inhibitors to reduce the chance of recurrence. In metastatic disease, the cancer has spread to other organs. The goal is to control the cancer and maintain comfort. First-line treatment is hormone therapy plus a CDK inhibitor. If cancer progresses, fulvestrant or targeted drugs may be used, and chemotherapy is reserved for later stages and rapidly growing disease. Radiation is used in some situations for symptom relief. And that brings us to the end of the video. Thank you for your time. If you found the video informative, please share it with your family and friends. If you're new here, please check out my other videos and subscribe to the channel. We'll discuss HER2 positive cancers in the next video. Until then, take care.